Hi everybody, I have the honor and pleasure of having with me Dr. Priyank Bhargav, rank 45, AIMS, November 2017. Heartiest congratulations.
Thank you, sir.
So how are you feeling?
I'm feeling completely overwhelmed. It's an amazing feeling to get this rank with the amount of time which we have in internship to study along. So I'm pretty happy with it.
Feeling top of the world?
The feeling on top of the
Top of
world.
the- Do you want to begin by thanking maybe important people in life?
I'd like to thank my parents first of all. Like they have been an very good support for me, support system for me. My relatives, my friends, especially my seniors who have guided me a lot throughout the internship time on things like how to study, what to study. So they have been very helpful, and it is thanks to all these people and of course the faculty of DAMS which I've been able to achieve this.
Thank you so much. And I think we were discussing that you joined us in the foundation course and
Yes,
then
sir.
you followed up with the test and discussion.
Yes, sir. In the
So,
Gautam Nagar batch.
yes, in the Gautam Nagar, yes. So, I would like to start off with the experience in the foundation when you started attending classes. You
Yes,
know,
sir.
did you find a difference in yourself when you started attending classes in and or in the concept building and all when you started attending the foundation course at that time?
Yes, when I started with the foundation course, I felt that most of the important topics were beautifully highlighted by each and every faculty. And what the main point which I thought was helpful was that say if you're starting to read a standard textbook like Bailey and Love or Harrison, so you don't exactly know what are the most important points on which you should have to focus in that. So once say you have attended the foundation course, the faculties have taught you the different topics, so then if you go and study from these standard textbooks, your concepts are also very strong, and it saves you a lot of time also on things like what you have to study. So it was pretty beneficial in that way.
Yes, and that give you an orientation towards the
Yes,
the entrance exam.
it built a very strong foundation for me for the final prof, which kind of I took that momentum internship and finally cleared it.
Any particular teachers from that time? Do you remember, like when you were attending the foundation course, any teachers that particularly made an impact at your mind at that time?
Obviously, like your classes and classes by Dr. Deepthi were simply amazing. Like I have no words for them. Apart from those two, I felt that surgery was pretty good by Dr. Rajiv. I felt that that was he taught conceptually as well as all the good like facts which you must know, the essential ones. And orthopedics was very good by Dr. Tushar, and the rest of them were also pretty good. But these are the ones which I very fondly remember.
Yes. And then you changed over to TND in internship to test and discussion
Yes, sir.
course. And so, what was your experience in TND? Like when you came to TND, you have to do a paper, then followed by discussion.
Yes.
And the approach is different from what we do in a classroom program. Like in foundation, we teach and then we ask you to do a test paper. Here, it is the test first and then discussion. So, did you enjoy that format?
That format I feel is the real advantage of the test and discussion course, because it gives you exposure to questions. The point is not that you skip the test and just attend the discussion. Like theory you can read from anywhere, but giving the test, sitting in that environment, academic environment, and that helps you like think on your feet and think fast, think about good logics. Like even if you don't know the answer to that question, you used your deduction and ruled out some options and then marked it. So those things you can only learn from the test. You cannot learn that by just attending discussions.
Yes, and I think in one of the previous interviews that we were having today, we discussed that there are two parts to any preparation, like content and application. So, like some people they are good at content, but when it comes to applying that content in the MCQ, that
Yes.
lacks. So that balance is reached by a TND course later on.
Yes, sir. Like application of your knowledge, I feel is really important for a paper like AIMS, because it is not. There are many facts which obviously an MBBS undergraduate possibly cannot know, but using your powers of application and deduction, you can still solve those questions, because if your basic concepts are clear, that will help you rule out some options, and using slightly good logics, you can just mark the question.
So the exam skill is like what you're trying to tell us about the like. Let's suppose somebody doesn't know and a question you're able to rule out because he has basics correct.
Yes, sir.
And then he is able to put some logic and get to the answer and finally get to the final two and then
Yes, sir.
put the answer back. Because what I feel is in an exam like games where it is so competitive to be in top 50 and you are in top 50 in this premier exam, and I again wish to congratulate you for this
Thank you, sir.
awesome rank. In more than 50,000 students appear for this exam in November, and top 50 is a great rank. So I feel that to get into top 50, it is like content, application, and that common sense on that day.
Yes.
That also works because they ask new questions.
Yes,
Yes,
sir.
they ask new questions every time. So, and like many of the listeners have actually requested me that to highlight some topics, like somebody is studying today for the next AIMS, for the May AIMS exam, and he wants to know, like, from you, who's a top 50 ranker, that what topics should he stress upon? Topics like anything in particular that he should read at least in this 6 months for the next AIMS.
Yes, I feel that micro is one subject which is very beneficial to study, like particularly clinical microbiology, like infections and their say histology images and treatment of common infections. That was many questions were asked on microbiology. Apart from that, I feel like you should focus on basics of medicine, not very rare diseases in cardio and neuro. Like they are not asked that much, but if your basics are clear, then you can easily score the questions. Apart from that, I felt orthopedics is one field where you can, it is a direct correlation between the amount of time you spend studying and the number of questions you can get correct in that. And obviously biochem is also one subject which say 8 to 10 questions come from biochemistry in the paper. So if you study biochemistry thoroughly, you can mark all of them correct. So it is a very high yielding subject to study. And anatomy is also very high yielding if you focus not mainly on the theory part, but you see a lot of images, you have a whole representation of the human body in your mind when you're sitting in the paper. So you can easily solve questions even when if you don't know much things about the question which has been asked.
And I would like to know that, like, have you decided any branch that you want to opt for right now?
I'll obviously think about it, but presumptively I feel I'll go for general surgery.
You have a surgical
Yeah.
friend of mine now. That's great. And I think AIMS is one of the premier institutes to do your surgical residency from.
Yes, sir.
Not only in India, I think globally speaking, AIMS would give you world-class experience.
Yes.
Right. I'm sure country will get a great surgeon once you do your residency from there. It's an honor to be interviewing you today. I also want to find out from you today, because a lot of people who are sitting listening to you today, they would want to know, like, what traits, what personality trait do you think you will give credit to for your success? Like, somebody is a high achiever. Why are you a high achiever? Do you have, like, hard work? Somebody would say selective thing. What is your secret?
I feel I am more of a fan of smart work as compared to hard work. Like you study the important things and not just you took a book and read it from end to end. That is not the right approach, I feel. And I feel that you study the important topics. Plus, it is very important to keep a cool mind in the exam. You don't have to worry about your rank. You don't have to worry how many questions you will mark. You just take a question as it comes, solve it very calmly, easily. Don't get flustered about it if you don't know the question. Just move on to the next. Very calmly attempt the paper, and it is not hard to crack AIMS exam. It can be easily done.
And plus, I have seen that sometimes there are a few obscure questions in the AIMS exam, and some people, they get very flustered, while there are other people who maintain their calm, because even the toppers are not able to do such
Yes,
questions.
sir.
And then so the maintaining your calm is a very key message that he says. And he again wants to remind you, it's about smart work, like doing everything cover to cover and not retaining anything. It doesn't make sense. His idea has been to kind of identify what he wants to do, and then put in more work on those topics.
Yes, sir.
That has been his strategy throughout. And I think a lot of people can learn from you how to do smart work. This is his mantra. And now I am putting you in a hot seat. I want you to say something motivating to people who are listening to you. We motivated you in the past. Now we pass on the baton. I want you to motivate other people by saying something that will fire them up.
Yes, it is a very genuine advice from my side that it is not difficult to crack the AIMS exam. It is just that it is a thing which has developed in your mind that AIMS is tough, AIMS is tough. It is not the case. You can easily crack the exam. Just keep a cool mind, focus on your basics, and it will be more than enough to crack your exam. Don't worry about what rank I'll get, how many questions I'll attempt. Easily you can crack the AIMS exam. I feel that.
So focus on your basics and do smart work. cool mind. I think these
Yes,
are
sir.
the
Yes,
three
sir.
mantras that he wants to give you today.
Yes, sir.
With this, we are signing off here. I wish him all the best again. I am sure country will get a great surgeon from him in future, and I am sure he'll do well in life. Congratulations and wish you all the best.
Thank you so much, sir.